And welcome into To Your Health. You know, one of the big things the new administration wants to try to do is keep people from getting addicted to drugs. Addiction to drugs is something that can really put a strain on your mind and, of course, cause mental illness. Dr. Will Rutland's with us today, and you are the chief of the residency program at Baptist South for the University of Alabama at Birmingham School of Medicine, Montgomery campus.
That's exactly right.
With the psychiatry residency.
There we go.
I know you get all in there one way or the other. One way or the other. But, you know, one of the things that we continually hear is that there are a lot of drugs out there, and we say, well, let's make some of them really, let's not worry about some of them.
Sure.
And one that comes up a lot of times is marijuana.
Yes.
And I'm, medical marijuana, because you're, obviously.
Sure.
And then obviously just marijuana in general.
Too right, and it's a very complicated issue. Just to quickly touch on medical marijuana, there is some evidence that certain cannabis products can help primarily in neurological illness, and that tends to be seizure disorders. Unfortunately, there's a false narrative out there that marijuana can help with anything, and that's not true. In fact, it makes some things worse.
Because they talk about it being like, well, that's going to take care of the pain.
That's right.
Of the medical condition you have.
That's right. And so, it's a very slippery slope, and unfortunately, some of the information out there is incorrect. Now, there are kind of non-direct uses. I don't want to paint it all bad. Certain parts of the experience of using a cannabinoid, which is one of the active ingredients in cannabis, can be useful clinically. So for instance, if you have someone who's on chemotherapy and has lost their appetite, there are some synthetic cannabinoids we can use to help with their appetite. So it's not treating anything so much as it's helping kind of deal with the side effect of other medications. So there are very limited uses where marijuana can be useful medically. However, in most contexts, the bad far outweighs the good. And unfortunately, people think of marijuana as benign. And there may have been a time when it was. I'll grant this. In fact, I'll tell you, I'm going to take us all the way back to 1969, the summer of love. I want you to picture yourself in Golden Gate Park. If you had smoked some marijuana in Golden Gate Park in 1969, it would have been 4% THC, which is that active cannabinoid. If you went today and bought a baggie of marijuana here in Montgomery, Alabama, the average is 30% THC. So it's now 7.5, nearly 8 times more potent than it was in 1969.
It's like a little bit of sugar and a lot of sugar.
That's exactly right.
Yeah.
And unfortunately, the human brain is not capable of processing that in a safe way. And for certain people, it can be exceedingly dangerous. So if you have any genetic predisposition for serious mental illness, especially things like bipolar or psychosis, it is likely that that level of THC is going to provoke schizophrenia or some other significant mental illness. And unfortunately, once provoked, the treatments that we usually use don't work as well on cannabis-induced, say, psychosis. So I see a lot of young folks who end up in the inpatient psychiatric hospital who are psychotic because they got hold of some powerful marijuana. And I can give them all the antipsychotic medication in the hospital, and it won't help because it's a different form of psychosis. And so they just languish in that.
And a lot of times that what they're doing with that marijuana, which they think, well, it's just marijuana.
It's
just marijuana can lead to, well, no, I needed something that's a little bit stronger to get the same effects.
That's exactly right. And so, and now these days, unfortunately, that can lead in 2 directions. You may know that there are more and more pure forms of the chemical in marijuana that's addictive.
Yes.
So people are using resins and vapes and things called dab or crackle, and then the THC content can go all the way up to 90%, and then it's quite dangerous. Or they can dabble in other drugs, and these days, almost any other drug is going to be potential exposure to fentanyl. So no matter what you think you're doing, there's likely fentanyl in it, which will just kill you. And so whether you go down the marijuana pathway and you're exposed to increasingly potent cannabis, or you skew off into another pathway and you're exposed to fentanyl, all of this is very dangerous right now.
Well, thank you for what you do. And the residency program has been here now for about 2 years.
Yes.
It's going to grow. They've got 8 residents in
working towards it. That's right. I'm
working
recruiting
toward
right
8.
now. That's
You're
right.
getting them going. So, and that's another thing that Baptist is doing for us right here in our own backyard. And we'll be right back right after this.